hope you can hear me. Well, I know I'm coming live after a few weeks, and there was a reason for it. I was traveling. I was traveling to one of our very premium TaiCon conference, which is for entrepreneurship, and I've been associated with Thai for over 20 years. So if you were in Silicon Valley, everybody was talking about TaiCon, startups, entrepreneurship. Well, coming back to our topic today, and it is a very important topic because I know not many of you would have heard about PHE, or what is public health emergency. So let me give you a little background what it is. So we all have gone through COVID-19, right? We have seen how COVID-19 happens. Now, what happens in early 2020, which is exactly 3 years ago, Congress and the administration, and especially healthcare administration or CMS, they worked very quickly to implement hundreds of waivers to medical groups, physicians, even hospitals, but primarily to medical groups and physicians. And it extended them a greater flexibility to run their medical practices. Now, one of the major flexibility which was given to them was telehealth. And what happens during that process, every practice, all kind of practices started using telehealth to serve their patients. And it became virtually the lifeline for patients as well as for physicians. Now it's been almost 3 years, and this year on May 11th, this year, they are ending the public health emergency. They are concluding it. They are saying it is not an emergency anymore. So all of those waivers which were given through CMS to medical doctors, providers, physicians, they're also coming to an end. So a lot of our physician friends, a lot of our doctors, a lot of our healthcare startups actually, who are into telehealth field, they need to listen to today's webinar. It is very important. Or they need to go to CMS and find out what are the changes or what are the waivers which are lifted. Because if they don't do that, there is a possibility that they are going to make mistakes, and it would be their medical practice would be out of compliance. Startups who are not going to listen or not going to see those changes which are happening or the waivers which are being lifted, they're going to continue making mistakes and use their resources, or probably they are going to waste some of the resources which they already have. You can find all of those details for free of cost on Medicare, US Medicare website. CMS has a website. You can go there and download. All of those details are there. Some of the data which I have taken today is through MGMA, but you can also find that data on the CMS website. I hope you are able to hear me today. So we'll start with one of the major waivers, which was telehealth waiver. So I'll give you an example how it works, and I'll give you the timeline also. So like a lot of these services earlier, before early 2020, beneficiaries, means patients, they should receive telehealth only in rural areas. But during the COVID time, CMS said any patient from any location can be seen anywhere. So the location was the main thing which was lifted. Earlier, you could only provide telehealth services to the patients who are in rural areas who cannot travel to the doctor's offices. But during the pandemic time, post-COVID, what they did is they quickly lifted that waiver, and they said all the doctors, every physicians, that they can provide telehealth services from any office to any patients who is sitting at their home. Now, that particular policy and waiver is now going away as of December 31, 2024. So all of those medical practices, medical groups whose primary services are based on telehealth. This is a time to alert themselves, review your resources, find out what resources you are using, what resources you are not using, and what you're going to do after December 31st, 2024, because you won't be able to see those patients using the same waiver. So location is very important. Second thing, and you know what, I'm going to show you this, like, so it would make it easier for you to see this screen. Let me send you this screen. And then I will also add myself here. I think I can add myself here too. And then I can also add myself here. Okay, perfect. So now you can see me and you can also see the screen. So the first thing I talked about, geographic location, right? The second thing we are going to talk about, who are the qualifying providers. Only certain providers are allowed to deliver telehealth services before PHE policy, like before year 2020. Only certain type of providers, so like mental health providers, or people, there are only very certain category of providers or medical doctors, practitioners who were allowed to deliver telehealth services. After 2020, provider extended to everybody, even PTs, OTs, SLPs, anything which can be remotely done through a consult or advice. They started allowing those patients and those physicians to use telehealth services. That is ending on December 31st, 2024 again. So only exception would be probably mental health services. Mental health services is a part of, um, you can that waiver would continue to be there. So accept mental health services if you have a practice which is, go to CMS website. They have a list of qualifying providers and list of qualified consults which you can do, which you cannot do. So that's the second thing. You have to see yourself whether you qualify moving forward to continue providing telehealth services or not. Third, audio only services. So there were claims which were paid even if you just call a patient and give a consult. You did not have to cover audio visit without a visual component before pre PHC policy, but now CMS will reimburse for services via phone and E&M visits. Even E&M visits, if you're calling the patients, they were being reimbursed during these 3 years period. Uh, that flexibility is not going to live anymore. So as of December 31st, 2024, you're not going to bill just for audio only services. You cannot make a phone call and bill for it. You can call a patient, but it will not be a billable visit as of December 31st, 2024. So these are the three major questions. So like if you're calling, if your patient through FaceTime, or your patient has been doing FaceTime or a video FaceTime or a WhatsApp video call, it's not happening anymore. Because as of December 30th, 2024, you cannot use those technology. But what you can use is, you can do a telehealth using HIPAA compliant technology. And there is a list of all those technology providers which you can find from the CMS website. So if you have an EMR which telehealth is a part of your EMR, you can continue to see those patients for certain, again, only for certain type of visits, not for all kind of. So you cannot see a new patients via telephone. You cannot do a consult over FaceTime or anything like that. So as of December 31, 2024, either call the patient in your office or go through the list from CMS. It's a long list. I have the list somewhere, but I'm not going to go through all the details. But there is a list on CMS website. And depending upon what kind of codes do you bill, procedures you do in your office, you can continue to bill. So FQLC and RHC, so they could not qualify as a distant site providers, but then they start qualifying as distant site providers. That is not going to happen as federally qualified healthcare centers or regional healthcare centers. But as of December 31, 2024, absolutely they cannot be a distant site providers. Payment parity. So telehealth services were reimbursed typically lower facility rates, like $28 or something per patient. But what happened during the COVID, you started billing your consult codes. So it is reimbursed as just like as in-person rate. And even if the modifier 59 is that modifier 95 is used, then you put it 99214, 99215, and you can be paid for telehealth visit, same what you were being paid when you were seeing the patient in office. So that was a huge relief and relaxation and a waiver for doctors' offices, which is not going to happen as of December 31, 2024. So that's a big change. So those who were enjoying telehealth as a part of technology enhancement in their office and doing the consult, you would not be able to do it as of December 31, 2023. So you can't even do it right now. This is already dead. You can't bill for these patients anymore. State licensor. So earlier what happens, the providers has to license in the state where patient is located. This is big thing because a lot of these doctors who do not have a Medicare, let's say if a doctor resides in Texas and he wants to see a patient in Florida, he was not able to see it. But during these pandemic, during these 3 years, all of these telehealth companies were making money on these visits because the medical groups were hiring physicians out of state left and right, and they were seeing patients anywhere in United States. So that is not going to happen anymore. It is already stopped as of May 11, 2023, 3 days before, or actually yesterday. So you cannot, you can only have few conditions. So like if you provide four conditions, you can treat patients in other states, but you should still comply with the state licensing requirements. So if you do not have a Medicare in the state of Florida, you cannot see Medicare patients. You have to apply for your license here in the Florida state of Florida. You have to have a Medicare here in Florida. Then you can see the patient, but not without it. So cross state licensor, it's just make sure that you have a license if you are seeing a patient out of state. You just cannot do it right now. If you bill it, you are out of compliance. HIPAA compliant platform, that's my favorite subject. What is HIPAA compliance platforms? So FaceTime is not going to work anymore. WhatsApp is not going to work anymore. You cannot call a patient and give a consult over the phone. You should use a HIPAA compliant platform. So during these 3 years, this HIPAA waiver was given that, okay, even if you are using a FaceTime, it doesn't matter. If you are able to use WhatsApp, doesn't matter. But that's not happening anymore. So all of those platforms, we like Skype or video calling or any kind of video calling or phone calling. So that's not going to work after as of August 9, 2023. So you have a 90 days from now to replace all of your non-HIPAA compliant telemedicine equipment to HIPAA compliant telemedicine equipment. You can do it for certain things, but not all. Like mental health services is exceptional. So it is completely exceptionally, you can see the patients, you can continue to do behavioral health patient counselings over the, but it has to be HIPAA compliant. So make sure if you're using any kind of third party devices or third party technology, that third party technology has to be HIPAA compliant. And there is actually the list of all those HIPAA compliant softwares from Medicare on their website, and you can really go through that list and you can find if your solution, or ask person who is giving you your solution that he is giving you the solution and he is actually using that. So with this, where is an opportunity for startups and where is an opportunity for technology service providers in this whole game? Because this is ending. This is a big public policy change, and this public policy change can give you a lot of opportunity, but at the same time, you need to go back and look at so a lot of these telehealth companies and telehealth solutions which has come up in last few years, they have to go back and review their strategy, what they are going to do in this year or after this year. Similarly, if you're a medical billing company or if you're an RCM solution provider, you have to go back and change your codes and make sure that your codes, which you are populating in a EMR for certain telehealth, either they need to change or you need to educate the doctors what kind of codes they are going to use moving forward. Telehealth codes are going to be changed because you cannot use the consult codes with 59 modifier anymore. So consult with your medical billing company, talk to your EMR company, and see what you can do after um, this public policy change, because this is a big change and we all need to understand and unwind ourselves on our medical practices, how this is going to help. There are a lot of public resources. I'm associated with HBMA, Healthcare Billing Management Association. I'm also connected with MGMA. So these are two very good resources. They have resources on their websites. You can become their partners. You can do whatever, you can talk to our office. Practice Forces offices are open if you're our existing client, or you can just simply call our office and we can help you understanding this more. So with this, I'm going to take a leave today. Happy Friday and enjoy. And if you have any questions about healthcare public policy, please feel free to reach out to me. You can send me a message on LinkedIn or you can send me uh, a text. So thank you very much. Have a great day.